Thank you very much for those who have hung in here. And we are starting back. We are starting back with a workshop, so I encourage people in the soft seats to come down and join a table, please. You can sit in a soft seat later, but now you have to come and join a table. And the next workshop is Kim Slade from PSHSA, the Public Services Health and Safety Association. And we're going to talk about nomenclature, what words mean, and all towards building our understanding of workplace mental health and the factors that we can address. So here's Kim. Soft seats. Come down and sit at a table, please.
Yes, boss.
Okay. I'm such a taskmaster.
Hi, everyone. So I'm Kim Slade, and I'm the Director of Research and Product Development at PSHSA, and I sit on a working group with Val and Danielle for the Ministry of Labor. And these are actually all of the working group members. I'm sure Val probably mentioned this morning, but this is the working group. So we have the entire prevention system represented with various different people participating in the working group. And these are the high-level objectives of the working group. So this is specific only to 2017-18 activities. We had lots of other activities that we envision happening over many, many more years, but specifically this is what we're doing over the next year. So one of the key things was to establish a common understanding of workplace mental health across the system, build capacity and competency within the system partners, and increase awareness of the importance of workplace mental health and use of existing resources. So a couple of key components here. We wanted to make sure that when all of our staff and go out and talk to clients, that we're giving a common message across all of the prevention system partners so that we're all getting that common information out in a common way. So we wanted to make sure that we establish those common definitions, and then we build capacity through events like this and other events so that people have a better understanding and are more comfortable talking about workplace mental health with their clients out in the system. And then we also want to promote the use of existing resources. So instead of developing a whole bunch of new resources, we want to make sure that we're promoting the resources that exist and help workplaces identify the resources that best fit their need. So today we're going to focus on the first part. So each system partner has a specific lead role in the working group. My lead role with WSN is to establish a common understanding of workplace mental health across the system. So one of the key aspects of this is stakeholder engagement, and when Val was planning her event, we felt this was a great way to start the stakeholder engagement. So this would include our system partners, external partners, subject matter experts, workplace parties, and representatives to provide input into what we're calling a backgrounder definition, historical context, then develop the resource, and then validate the resource with stakeholders again. So first, we're going to develop or adopt definitions that will be used by Ontario's prevention system partners. Specifically, we're going to focus today on stigma, workplace mental health or psychologically safe workplaces, and mental health. Identify important historical context we should consider, and current state activities. And actually, we're going to do this in a different way because we're short on time, so we're not going to do that part today, but that will be a part that we'll want to engage stakeholders on. And then identify key stakeholders who should be engaged and mechanisms to engage them. So we're going to spend the next, I don't have half hour, 20 minutes, I guess, on the first bullet and the last bullet. Okay, so we're going to start with workplace mental health. And these are some sample definitions that I pulled from Gray literature. CSA, Mental Health Commission of Canada, the Canadian Mental Health Association, and the World Health Organization define workplace mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. The U.S. Department of Health defines it as our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. And Merriam-Webster defines mental health as the condition of being sound mentally and emotionally that is characterized by the absence of mental illness and by adequate adjustment, especially as reflected in feelings, comfort about oneself, positive feelings about others, and the ability to meet the demands of daily life. Postpone?
Yeah, do you want to?
Okay, so at your table groups, you'll find little sheets that are going to act as flip chart, because we don't have flip charts today and we're being environmentally friendly. We're going to use up agendas that didn't get distributed. So at your tables, talk about the definitions. And if you feel there's a definition that the system should adopt or not, and why or why not, how would you adjust the definition of mental health to reflect the workplace? And what is the importance of defining or not defining mental illness in a backgrounder for prevention system partners? So I'm going to encourage the people in the soft seats to come down, like Val was saying, and join a table so that you can participate in the discussion. For those of you online, you can either use the hashtag Mayday Mayday or Workplace Mental Health, or you can type comments into the comment section as a way to participate, and we'll get all of your feedback. So we'll give you about 5 minutes to talk about this particular definition. Then we're going to talk about two others and stakeholders. Okay, go. So you have about a minute left. Want to read them out? So Val, I'll start with the comments from the web. Okay. Okay, so we're gonna, I know that was a quick, short discussion, but we're gonna come back. I'm trying to keep us on time so I don't use up too much time of someone else's presentation. So we have some comments online, so I'm gonna ask Val to read out some of the comments, and then maybe a couple of comments from the tables. I am gonna collect the sheets, so make sure you took notes, because we're gonna use that to start to develop our working group backgrounder. So Val, do you wanna share some of the?
Sure, I'll go quickly. Actually, there's 3 comments, and all of them are essentially the same in terms of that they support adopting the definition already adopted by the CSA, because it's it's good for consistency across the province and Canada, and captures the importance of work-life balance. Although there is a comment related to that mental illness needs to be addressed from this perspective that mental health and mental illness are 2 separate but related components.
Okay.
Any?
Did any of the tables talk about something similar, or? Yes?
So our table thought that there was a nice combination between number 1 and number 2, further helping defining well-being, for example, and that they would use them together.
Okay, that's good. And there was lots of people nodding. That's
You rejected number 3.
Is there any other comments about anything? Yeah?
Not necessarily at the outcome, but
Yeah.
as a determinant of it. So,
Okay. You like that?
yes.
Okay. So you like that it's that it speaks about it being a determinant. Oh.
I like the we.
And you liked the we. Okay, yes? Yep.
Number 1 was the better of the 3 definitions, because although number 1 we thought should mention the role of the workplace and the context around the individual, and we thought number 2 was more about how the individual contributes, and it doesn't have the corresponding context around the worker contributing.
Yeah, so it needs more context of the workplace.
Yeah, well, number 2, we went with number
Yeah.
1 and said, because number 1 is about an outcome. So if the worker can be like this in this state of well-being, there's lots of inputs into that. And one of those could be organizational attention and change to psychosocial factors.
Okay.
But we thought it might be nice if that was spelled out a bit better, that it was a 2-way interaction.
Absolutely. You've got that on your notes, right? Okay, so we're going to quickly move on to the next definition, which is, what is a psychologically safe workplace? So the definitions that we have, one from CCOHS, a psychologically safe and healthy workplace is one that promotes workers' mental well-being and does not harm employee mental health through neglect, reckless, or intentional ways. Canadian Mental Health Association defines it as a workplace that does not permit harm to employee mental health in careless, neglect, reckless, or intentional ways. There's lots of similarities in these ones. And CSA defines it as a workplace that promotes workers' psychological well-being and actively works to prevent harm to a worker's psychological health, including neglect, reckless, or intentional ways. So, discuss the definitions again. Is there one that we should adopt or not, and why? Would you make any adjustments to the definition? And what prevention steps should organizations take to create a psychologically healthy and safe workplace? Again, you only have 5 minutes, so good luck. No. And then we'll have a quick discussion after. Ken and Cindy and Paul, do you guys want to join a table? You're going to do your own? Okay, you have to take notes.
Way to send them out. That was good.
I like number 3 in that I like the word prevention.
Yeah.
Prevention in there, I like that.
I like number 3 because it says active too.
Right,
Yeah.
exactly.
It's not just don't act, whatever, yeah.
Right, it's not just a one-shot kind of come and go.
The second one is only preventing, right? It's not, or it's only, it doesn't get into any type of.
It almost seems like number 2 is reactive and it's not going to permit it. So if you do this, then there'll be a consequence for it. Active piece to it.
I do too.
Number 3.
Careless besides negligent.
Okay,
Careless, I
so
just
you
like
could
that one,
add careless to it.
Yeah.
Number 3 plus careless.
Is that good enough, do you guys think?
Yeah, I think so.
What's the consensus?
As opposed to. Right, yeah.
But it's also very top down. Permit.
And
has to
it
be-
doesn't put any onus on the worker either, right? Prevention steps.
And see, that also lends to why we like 3. In the question itself, it's saying prevent, and 3 has prevent in it. So that's
5 prevention steps.
kind of zero.
Burn, organize, assess.
So I would say what one of the most important things in any prevention actually take action. Sort of like the elephant in the room. If you've got a manager that's harassing workers, you need that manager. You don't need.
Although Terry's example was that there was harassing behavior and harassing experience.
Yes. Yeah.
some extent,
Yeah.
right? So if
Yeah. Yeah.
you
But you
just-
have to do both.
Yeah.
You
But
can have all
what
the.
Terry didn't tell you was 2 people had workplace before.
That goes
But
hand
that's
in hand.
good. That's
Exactly.
good.
You're dealing with
Yeah.
the source, yeah.
So that's hand in hand.
Because it's easier to revamp your policies and review your policies and do education and training. That is toxic and nobody wants to touch that manager or employee, whatever. There's still that person or personality and it's not dealt with.
Okay, you have about 1 minute left.
I find tolerance policies don't work.
Yeah, that's good. Okay, I'm going to bring you back to the front of the room. So is there a group that wants to start off? We won't start with the people online this time. We'll do them last. So how about at the back of the room there? What did your table think?
Oh, here, let me bring you the mic.
You like the third one?
Take a vote.
So we like the third one because it includes like a clear prevention mandate and talks about they have to actively prevent harm rather than just don't be reckless or negligent. It's you actively look for areas where you could improve. And so it sort of obligates the workplace to work on the problem.
Right.
Right.
So how many other groups picked number 3? Yeah. Psychosocial? You changed psychological to psychosocial? We talked about it. Okay, were there any other changes? Danielle, was there a change? Oh, Danielle? And then we'll...
We had just decided that we wanted to add careless to the definition, so to add in there to add careless to negligent and reckless or
Right.
intentional ways.
Okay. And
Oh, okay.
Sort of in the same area, we're talking about negligent, reckless, intentional. Just before that, we would say including but not limited to.
okay. That's good. All right. And then we'll come to you.
I don't think we're repeating, is a similar comment to the first table, but we liked the third, well, we had lots of discussion comparing and contrasting, but the third definition, but however, we would appreciate a reversal of prevention to the top or first rather than promotion. So working to prevent in the primary of the hierarchy and the controls
Okay.
at the source, and the promotion coming kind of further down in importance in the definition.
That's good. And Val, there was someone at the...
In the third definition too, maybe thinking around something that identifies kind of a clear structure to address when situations do occur. So you have kind of the prevention focus and the promoting of mental health, but also at the organization level, that there's a commitment to identify, how you respond to cases, because you could do the best prevention, but if a case does happen, you feel secure that there's a clear way.
Good. Okay. And do you remember what they said online, Val?
It was all endorsing number 3, but let me just race back to the computer. I should switch back into my walking shoes, I think, for this section. I think similarly prefer CSA because actively is in there and prevent is in there. Prevention particularly. And then someone else is commenting that there should be workshops for staff on how to deal with conflict, gossip, cliques, and things like that. So that's maybe that goes beyond into
Education.
Education,
The
yeah.
education component. Okay, great. Okay, one more definition. So this one is stigma. So one of the literature highlights that stigma is actually a significant barrier to people seeking help. So we felt that this was an important definition to sort of establish, and the definitions are a little bit different. So the CAMH describes stigma as negative attitudes, bracket prejudice, or negative behavior, bracket discrimination, toward people with substance abuse and or mental health problems. The CDC describes it as an attribute that is deeply discrediting. The stigmatized trait sets the bearer apart from the rest of society by bringing feelings of shame and isolation. A negative stereotype or a negative or unfavorable attitude. So, is there a definition that you feel we should adopt or not? Again. And how would you adjust these stigma definitions to reflect the workplace? Stigma in the workplace, if that's required. And what prevention activities do you suggest to address stigma in the workplace? And you'll have 5 minutes again.
Second one too.
Yeah, I didn't give you a 1-minute warning on that one because I was getting involved in the discussion. Sorry about that. All right. This is a this one fostered a lot of good discussion. Is there anyone who wants to share? We were rewriting our definition at our table, but how about the group at the front? You were having good discussion.
We thought that a combination of the first and the second definition kind of covered things. So what we were thinking was we liked negative attitudes and negative behavior toward people with mental health problems. And then we thought taking it from the stigmatized trait sets, and we thought instead of saying the bear, we thought an individual apart from the rest of society but bringing feelings of shame and isolation. And then we thought that was enough, that we didn't have to really reframe it at all towards the workplace. We thought that really would cover everything.
Right. Okay. Ken?
So just like to state that although we're not sitting at a table, there should be no negative stereotype that we're actually not productive back here, because we were feeling shame and isolation to a certain degree. We felt perhaps a blending of number 2 and number 3, in that if we started with this stigmatized trait sets the employee apart from the rest of the organization by bringing feelings of shame and isolation based on a negative stereotype.
Good. Okay. Jules, did you? Oh.
I think I've captured what we're trying to do, but please help me if I've made a mistake here. But we were trying to combine definitions 1 and 2. So it would read something like negative attitudes or prejudice and negative behavior, discrimination, toward people with an attribute that sets the bearer apart from the rest of society by bringing shame and isolation. Attributes include, but are not limited to, substance abuse, mental health problems, etc. Did we have any more? Okay.
Anybody else want to share their thoughts?
Fine.
Okay. I hope you're all capturing your notes because I'm going to collect those sheets at the end of the day. So one more quick exercise. I'm only going to give you 2 minutes to do this one. So brainstorm a list of key stakeholders that the health and safety organization should consult regarding this. So who should the working group be talking to? And what are some mechanisms for us to engage these groups? Should we be doing surveys? Should we be going to meetings like Section 21 meetings or, I don't know, association meetings to do workshops like this? What do you think? So I'll give you 3 minutes to do that, and then I'm going to move on to my next presentation right away so that we can move the agenda along. Give you a 1-minute warning. Okay. Does anybody want to share some of the stakeholders they identified? Or mechanisms, quickly? Anybody? Ken?
And, you gotta just show, no, I guess.
So one of the mechanisms that we thought would be interesting to look at is appreciating that the Joint Health and Safety Committee training for Part 1 and Part 2 was recently launched, but for the most part, I would say across all the different industries that is listed, the majority of the hazards that are identified and are discussed at Part 2 training have to do with physical hazards in the workplace. So is that an avenue whereby, and I'm sure Jules is going, oh, don't change the standard on me, but is that an avenue in terms of psychosocial or mental health whereby the Joint Health and Safety Committee could be the ones that would be a major stakeholder in any change that would be made?
Yeah, I heard that at some of the other tables as well. Are there any other key stakeholders that your groups identified? Okay, so I'm just going to skip ahead. I'm going to skip a few slides because we aren't doing the break. And I'm going to go right to my, I'm going to share my, what PSHSA has been doing around workplace mental health, and I'm not going to take, I hope I'm not going to take a full 10 minutes. So our primary focus over the last year has been around first responders, with the presumptive legislation coming out and helping the minister provide a toolkit to workplaces. So we wanted to provide a toolkit to first responders and their employers that provided one easily accessible destination for credible PTSD resources. If you type PTSD into Google, you're going to get thousands of hits of information. So we wanted to make sure that we were providing one sort of easy to access, easy to use toolkit to help employers develop prevention plans. But as we moved along this process, we realized that we also have to provide tools and resources to workers. So we started adding things in. So we started the conversations in January of 2016 with the minister's office that something needed to be created to support workplaces when the new legislation came out. We did our first proposal back to the minister about what that should look like around January 11th. On January 2nd or February 1st, they asked for a revamp of our idea, which ended up being First Responders First. It kicked off on February 18th, and we launched on March 4th. Amazing. So, and this had to tie to an announcement the minister was making. So we had to have something up and ready to go for March 4th. And in that time frame of development, we actually did stakeholder consultations. So we did interviews. We split it up between members of our staff. People called key stakeholders. We sent out emails with questions. We sent out the mock-up of what was going to be on the website, and we gathered feedback. And then as we developed, because we had such a tight time frame at the front end, We continue to do stakeholder consultation as we develop. So as we started creating things and putting it out there, if people had feedback, we took that in and we revamped or changed the way the website looks. So that's how it morphed from being employer focused to then including other stakeholders within the workplace. And we continue to, this is an ongoing iterative development, I would call it. So it's getting results. People, and this is from January, I would say now probably this has gone even higher. But we continue to see unique visits to first responders first, well above this now. I just wasn't able to get the updated stats because I was on holidays last week. But the prevention plans are in, and there was a lot of activity on the site. So we're definitely getting traction. The site was based on what we called the PTSD prevention framework. So I worked with Dr. Ash Bender, who was my subject matter expert. He's from CAMH. And we tried to marry sort of his perspective or a psychiatry perspective on workplace mental health and prevention, along with the occupational health and safety management system. So a key aspect of what we wanted to do was make it recognizable to the workplaces who had to develop these prevention plans, so that you weren't suddenly feeling like you had to deal with this whole new hazard and you had no roadmap and you didn't know how to do it. We wanted to have things in the language and the way we talked about this that people would recognize and go, oh, I have a policy on identifying hazards in my workplace. Now, how do I build mental health or specifically PTSD into that so that I can now recognize that? And then we also, when we spoke to the stakeholders, there was a lot of anxiety about, do I have to be best in class? Do I have to be like the best at this right out of the gate? So we felt it was really important to then establish a pathway. So this is really building in a pathway. And our message was, it's important to get started. It's a continuous improvement process, just like any other occupational health and safety management system. You put something in place, you evaluate it, you continuously improve. And we wanted to recognize that not everybody was ready to be at implementing best practices. We wanted to educate them about what that would look like. So as an example, in implementing best practices, that's where you're looking at workplace mental health holistically and occupational stress injuries holistically, whereas at getting started, we were dealing with the requirement for submitting a PTSD prevention plan. So that's sort of like, that's what it looks like. And we were trying to build in the primary, secondary, and tertiary prevention activities. So for each of these phases, the just getting started, taking proactive steps, and implementing best practices, there's 3 10-item questionnaires that an organization can fill out to assess themselves, and that provides them an action plan to build or continuously improve their workplace prevention plan. The site provides tools and resources for workers, supervisors, and the organization. So the ones on the left of the screen are more around the organization, and the ones on the right of the screen are more around the worker or supervisor. And these are just examples. So there's organizational assessments for each phase. There's a PTSD perception survey based on work that Mental Health Commission of Canada did. There's a risk mitigation framework and sample screening protocol. There's sample policies and procedures. There's links to the WSIB resources and policies related to this. There's an EAP community support assessment. So it's like 20 questions to ask your EAP to make sure they're ready to take calls from your workers regarding this particular hazard. And there's also community support groups across Ontario. We wanted you to also use similar questions to have conversations with your local community support to make sure that they were able to provide support to your workers. There's a communication strategy, and there's information about setting up a peer support team. For workers and supervisors specifically, we wanted to make sure that a supervisor had tips or tools on how to deal with a crisis and what to say to workers after they've been exposed to traumatic events. So what do you say when they come back to work? How do you start those conversations? Because the stakeholder was saying, we don't even want to have these conversations. We don't know how to have these conversations, and we don't know what to tell our supervisors. So we wanted to make sure we provided tips and tools. There's self-assessment tools for the worker, and that guides them as to, and it's based on evidence, as to whether or not they should be reaching out to a psychologist or their family doctor or a physician. And on the site, there's little boxes you can click, and it gives you directories of psychologists across Ontario, directors of physicians, and you can search that by type of physician. And then there's also local community supports on the site. There's what PTSD might look like at work. There's return to work tools. There's all sorts of things. So the feedback now has been there's so much on the site. People are having trouble finding things. So right now we're just going through the process of improving the usability of the site. It was developed very quickly, and it's been a very iterative process. So now that we have all the content, we're kind of going, okay, if I'm a worker and I come to this site, how can I make the site more usable? So that's what we're doing right now. The focus of our messaging to the community was to set foundation for success, to align with the culture and existing occupational health and safety systems in their workplace. So build off of where you're currently having successes or where you currently have strengths. Just get started. Don't get overwhelmed. If you currently don't, and I know the occupational health and safety people in the room are probably going to freak out when I say this, but if you didn't have something like a return to work program, your return to work program isn't robust, talk about establishing a return to work program in your plan. Say that that's something that you're going to work on. Don't worry, like you can't build a return to work program for PTSD if you don't have it for just general injuries. And so you have to look at your system and where you are and build off of that and start to put those building blocks in place. And then grow and change the program as you learn more and you have more things in place. These were some of the engagement activities that we did. We ran webinars, we ran workshops, we did consulting with all sorts of sizes of organizations. We're going to be developing an awareness e-learning on specifically PTSD and anti-stigma. We've submitted proposals for partnership in research, in mostly ROP, Research Opportunities Program, and OSHPIP, on a variety of different things, peer support programs, an app, training, all sorts of different ones. And right now, if you go to the Ministry of Labor website specific to this, there are 82 out of about 444 plans posted, but I know that the Prevention Office is very busily looking at all of these prevention plans and posting them. So they were due on April 23rd. And since that time, they've been updating this site on an ongoing basis. So you can go and see all of the ones that have been submitted. So that's it.
Great, thanks a lot, Kim. There is one question, and maybe you want to address. It's a question around, is there a program for personal support workers? Because they deal with things when they visit people. So
Yep.
they deal with death, Alzheimer's, dementia, aggression, and maybe just, the question is, are the tools, can they be used by non-first responders, I think.
Yeah, absolutely. So the site was written from the hazard perspective. So while you go on the site, it's going to look like first responders. There's pictures of firefighters and police officers and corrections, and the title, of course, is First Responders First. But all the content on the site is valid for any organization where you are exposed to traumas, and that's a lot more than first responders. So absolutely, the tools are good for it's focused on the hazard.
Great, thanks. Does anybody in the room have a quick question? No? Okay, thank you very much, Kim.